Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Areolar reduction. What is areolar reduction? It's surgery to reduce the diameter of the areola of the breast. Options include using camouflage makeup, which is not very practical, and of course simply wearing clothes to cover it. Some people are self-conscious because they have large areolae or feel that the areola are not the appearance or diameter that they would like, and for this reason will seek surgery for it. The surgery is relatively straightforward. It can be performed under local anaesthetic and takes around about 30 to 60 minutes depending on how large the areolae are. The surgery involves removing a donut-shaped piece of the areola and then using a strong permanent suture to hold the skin into the new diameter. As a result of this surgery, you'll have a scar between the brown colour of the areolae and the surrounding skin. In the normal areola, there's a short fade between the nipple-coloured skin and the surrounding skin, but afterwards you'll have a scar and a definite cut-off between the two. So this will be visible, and occasionally sometimes it may stretch. Scars usually heal very well, but they go through a phase of being red and lumpy, and this is quite normal and will take around about 12 to 18 months to settle down. Very rarely you can form a keloid scar. This is a growing thick lump of scar forming a ridge around the nipple. This would require further treatment and not further surgery, which often makes it worse. This may require an injection of steroids or application of silicone dressings. They are very difficult to treat and something that would probably require referral to a specialist. After the surgery, you'd expect to see some swelling or puffiness of the nipple and areola area, and there'll be some puckering of the skin around it as the larger diameter of the larger circumference of the surrounding skin is gathered up to the new smaller diameter of the areola. This usually settles within a few weeks. There would definitely be an asymmetry between the two sides. There's no way to make both areola exactly the same diameter, and indeed there's no way to make them definitely perfectly round. Sometimes they adopt a more oval or teardrop shape depending on your own anatomy. Any significant differences that are really obvious may need to be corrected, but in the vast majority of cases, differences between the two sides are within normal limits. Remember, the breasts are sisters, not twins. So what can go wrong following areolar reduction? Well, a wound infection can occur. The risk of this is about 5%, a 1 in 20 risk. It would normally manifest as redness, swelling, tenderness, and would usually settle in response to oral antibiotic tablets. It'd be very rare for it to be more than that. You may get some bleeding following surgery that would soak through the dressing. It'd be very rare for it to be anything more than requiring more than a bit of pressure to control the bleeding. Changes in the erectile nature of the nipples in response to arousal and temperature may occur. We have no control over these. Theoretically, there could be changes in response to breastfeeding, or perhaps some milk discharge could occur. I've not come across this, but it could happen. Theoretically, there's a very small risk of losing the nipple or skin loss around the area. The most common things that people are unhappy about are the appearance of the nipples. Either the diameter isn't as small as you wanted, although usually during the procedure we can show you and you can judge for yourself whilst it's being performed how big a diameter change that you want. After the surgery, you'll have shower-proof dressings that will remain in place for 1 to 2 weeks. We'll see you in the dressing clinic after that to remove them and any loose dissolving suture on the outside of the skin. Photographs will be taken at every stage to monitor progress. You'll have as much follow-up as you require following the procedure to ensure that you're happy with the outcome.